Greetings from Mumbai Obstetric Gynec Society. Friends, we are here to observe the World Population Day. Today is 11 July 2024 and the theme for this year of Population Day is unleashing the power of gender equality, uplifting the voices of women and girls to unlock our world's infinite possibilities. The focus is on advancing gender equality to create a more just, resilient and sustainable world. So, for this particular day, we have with us a celebrity doctor, celebrity gynecologist, Dr. Soonawala. But before that, I would like to say a few things about World Population Day, the history of World Population Day. So it was established by the United Nations Development Program, that is UNDP, in 1989. And this was observed because that day the world population touched the 5 billion mark. After that, since 1990, we decided to observe or celebrate World Population Day on 11th July every year. World Population Day plays a vital role in bringing attention to population dynamics and its effect on people's health and particularly women's health. So now I introduce the celebrity doctor, Dr. Soonawala. Sir, we are indeed honored to have you here. He doesn't need introduction, the whole world knows about him. But I have to say a few things about him. He is MD, FRCS, FRCOG, FICOG and consulting obstetrician, gynecologist even today till the age of 96. He has held several important positions. He has been Professor Emeritus, Wadia Maternity Hospital. He's been founder president of Indian Society of Prenatal Diagnosis and Therapy since 1989 and founder, member and president of several important organizations. But one of the most important awards, accolades that he received was, one of the 8 in the world, he was the first to be awarded for Grafenberg Medal for the original work done in intrauterine contraception by University of Kiel, West Germany in 1984. He was awarded Padma Shri by President of India in 1991 in recognition of his work in the field of family planning. Above all, he has experience of more than 44 years of obstetrics and gynecological clinical practice. He has extraordinary contributions in the field of family welfare. He has designed Soonawala intrauterine contraceptive device in 1963 and several other gynecological instruments and surgical techniques. He started mobilizing team of young doctors to go to rural India and conduct several sterilization camps. He modified the technique of vaginal sterilization and designed instruments to make the operation simple and safe. These instruments are described in gynecological textbooks and used for many other gynecological operations also. In India, he conducted and supervised large number of vasectomy camps, sterilization camps, and over 30,000 female sterilizations have been performed with the very low rate of complications by this team. Conducted advanced training program for doctors in Sri Lanka, Pakistan, Iran, Iraq, and I don't know how many countries. And since the past few years, the concentration on women's health, contraception, endoscopy, and infertility, training doctors for tubal reconstructive surgery following sterilization, and he has designed several instruments for that surgery and modified the techniques, and they are all very well known as Soonawala techniques. So, sir, we are really indeed happy to have such a celebrity doctor. I think he has delivered, I don't know, n number of Bollywood celebrities. So, sir, I would like to ask you first question, why has the population control program failed in India? Why do you think it didn't work when they wanted to control the population?
Any program that we implement has to be a program accepted by the client or the receivers, because it is not just an association or an organization telling a person, this is good for you, you have to do it.
Right.
So the people must be educated that the small family norm is a must for the present world. Poverty, disease, illiteracy are a curse to the humanity, and they are directly related to the large family norms. Countries where the family size has been cut down to 2 kids or 1 kid, and sometimes even no kid, that is also not very good. So it is going to be a necessity to bring on happiness in the human race. Hopefully at some time we will be able to bring happiness to all, and that can only be achieved if they themselves want to have a small family norm. We will provide the services, will provide the expenses for it, but finally it is the client who has to feel the need for it and accept it.
Thank you, sir. And what I remember as a child, I used to see those red inverted triangle, and they used to say do ya teen bus, and from that level today we have come in today's day and age. The couples just don't want to have any kids, they don't want to get married, and so I think there are two extremes that we have seen. I think you are the person who has seen all these years how the trend has changed over the years. So you think this change is because of the the programs that we have conducted, or it is the inner feeling that no, I don't want to have kids, I want to just lead the life I want?
My thinking, it will be the stress. The stress of money coming, the prices going up. I remember in 1958, I booked a Fiat car which cost only 10,000, 1100 Fiat. I got a delivery after 6 years. And now the same Fiat car, if you go, is worth some couple of crores.
Yes.
And housing, impossible. Food, impossible. Education, impossible. For a couple to bring on more than 1 or 2 kids. Both the husband and wife usually are now working. And that is another reason why they cannot afford to have a child till they start earning enough and they have a roof over their head and they have enough finance for a proper meal a day. And of course, when the child is born, to educate the child presently is something exorbitant, out of proportion.
Very true, sir.
Yeah.
So when you had initiated your drive to develop several contraceptive methods and do some work in that field, what was the need for developing new contraceptive methods and safe abortion techniques? So why did you think of it? And I think we have seen such wonderful those Soonawala's IUCD and those wonderful speculums and so many other instruments. So,
I finished my MD, worked at Wadia, worked at NIE, and at that time it was a sort of a routine, mainly doctors from Bombay, Calcutta, Madras, to go abroad to do further RCOG diplomas to be achieved. So I was also prepared for that. I finished that, I came back. I had a very, very important, and at that time when you start your practice, every lady that comes to you is important. You go out of the way to try to do the best of them. I delivered her normally, and there was a complication. complication of bladder retention. It was on a Sunday. The house doctor did not realize. She was screaming and shouting, "I'm getting pain, getting pain." And that lady was very educated. She is a leading solicitor of Bombay. Okay. And then the catheter, and then after a month the bladder worked. And before that, during pregnancy, we had discussed, and I had mentioned that either the oral contraceptive or one can have the intrauterine device. And she had selected intrauterine device. I was conducting a pool officer at that time by ICMR, so that the newly come Indian doctor don't go back. So they were giving 700 stipend and gave you a small project to do. So I was doing a project on the oral contraceptive. At that time, Enoblar, 10 milligrams. Okay. And a colleague of mine, a lady who was with me for 5 years in the medical college, also a gynecologist, was doing on Lipis loop. Okay. So I went and told her, "Can I have a Lipis loop? I promised the patient." She said, "No, impossible. You might perforate, you might do this, you might do that." Oh. And I had worked as a surgeon in UK. Okay. That was a long and a good experience I had. So then I started designing my own. Okay. I've got all that I can show, but it will become too long for this. So I started designing my own, and with the jig made IUDs and all that. Mm-hmm. And very close family friends were the Garware family. Okay. 4 brothers, we 4 brothers. And when we met, we were all unmarried. So I was invited to their house for dinner, and I was very mentally agitated because I could not get the IUD. And after a month or 2, that lady would be coming to get the IUD fitted. So he said, "What's wrong today? Why are you so looking grumpy?" So I mentioned the whole story. He said, "Tomorrow come out to the factory, we'll make it."
Oh, wow.
And that was a lucky coincidence. When I went to the factory, 4 of his main designers and people who were developing the molds and doing all the molding of polyethylene at that time was something very new. And so they started, I gave them the design, and I was told, if you copy Lipis loop, it might be a patent thing. So what would be next? S, the name.
Right.
So I designed that, and we started molding, and we started the ICMR trials and everything. But when India got the independence, Ford Foundation, US Agency for International Development, Population Council, were all having representatives in Delhi advising the Indian government on population control. And also SIDA, the Swedish International Development Agency, was also helping out India. Somehow they were all very keen to do and help out India. And they were supplying Lipis loop free. Oh. And that was no way it would be. And there was no way one can compete with a big agency like that. But still we had more than 20,000 patients who were on
That's
SIUD.
so good.
And
that's really wonderful. I think you met the right kind of people at the right time when you desired to, to design a new contraceptive. So I think that is really something, and I really appreciate the efforts that you always put in anything that you do, always with great zeal. And we have so many things to learn from you, sir. So would you like to give a message to our audience who are listening to us? What should be our future in population control? or maybe population stabilization, we have kind of
Yeah.
done some good work also.
In life, it's not how much money you have. The most important thing in life is to be happy. And to be happy is an art. A person can be happy seeing a flower, and a person can be happy even seeing gold bars and not yet satisfied. He'll be dreaming for getting more and more gold bars. So the message I would like to give to the people is learn to be contented and happy. And that is very necessary in life. You'll be able to go home and sleep well, otherwise your mind and thoughts will all the time be hanging like a sword over your head. I want to earn more. I want to get this more. I want, if you have a Fiat car, you'll say, I would need a Mercedes car.
True.
And it's a rat race. You can keep trying and trying and trying, and unless your mind accepts that what you have, in simple words I'll tell you, look at people who have less than you.
Absolutely.
Huh?
Absolutely.
And don't look at people who have more than you. When you look at people who have less than you, you will feel, thank God, I have been blessed to have very comfortable life, food, shelter, education, clothing, the necessities are there. So this is the message I would like to give, especially the young upcoming individuals. When they settle in life, they become a couple, and the message is learn to be happy with simple things in life.
Oh, that is a fantastic message, sir. I'm sure the young and upcoming people are going to learn a lot. Before we end this interview, we are going to come back to you and we are going to have a longer interview and your message for some more. But before we end, I would like to show this book, which sir has, Rashmi Uday Singh has written sir's biography. And it's a fantastic book. You can see the lovely cover page, and it's my pleasure and honor. Today, sir gave this book with his signature on it. I am so very grateful, sir, and I am honored with this. Thank you so much.
The amount of sacrifice, people don't understand. Your time, your energy, your time with your family to help monks to grow. This is something special. This is in, say, appreciation of the work you are doing for monks.
Thank you so
A
much, sir.
very
I am deeply touched. Thank you so
small
much.
gift, which nothing medical is in it. It's all about my sort of growing up and how the life
But
went
still,
on.
many things we would learn from it. Thank you so much, and we'll come back
Very
again.
helpful.